Folks, thanks for joining us today. My name is John Dubas with Premier Marketing, and we'll be discussing one of the programs that enable us to market year-round to a portion of the Medicare population that is not only in dire need of our help, but also a good market for cross-selling and continuous sales throughout the year. And that's dealing with the portion of the population that qualifies for low-income subsidy, sometimes referred to as special help. Today's presentation is being recorded, and once it uploads, it will be available on our website at premiersmi.com and on our YouTube channel as well. And if you're working with a marketer within Premier Marketing itself, they will have access to it as well. We are looking to send out emails with that link as well to everyone who's expressed interest in today's topic. You will notice in today's software system, well, in the software system we use all the time, that there's a section for both questions and chat. We ask that you put your questions in the question box. We find that we do normally cover most of them through the course of the presentation, but we will make certain that we get you the information you need to get full value out of today's presentation. You'll also note that much of the information that we go through will have some additional detail that will come to you as part of the follow-up too. So some of the numbers and some of the other things that are presented, you will have access to that. So to begin, let's start with a bit of level set about Premier Marketing itself. Many of you are familiar with us, but for those of you that need a refresher or an introduction, we are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. Offices across the country, licensed in all 50 states. We act as an insurance wholesaler, working through independent insurance agents such as yourself, offering that opportunity through contracts at the highest possible commission levels, with recruiting contracts available to those who qualify. We do so through a full portfolio of products that include not just the basic Medicare programs, the Medicare Advantage, Medicare Supplement, and standalone Part D programs, but also life insurance and annuity products, final expense life insurance programs, pre-need plans, long and short-term care programs, disability income plans, and ancillary benefits such as dental, vision, hearing, critical illness cancer plans, hospital indemnity programs, accident plans, and telehealth programs as well. Those Medicare Advantage programs include the national carriers and many of the strong regionals that can make a difference for you in your market. And that same philosophy, of course, carries over into the prescription drug programs, where many of these are part of the contract that you have through the MA programs, but there are a couple notable exceptions. Mutual of Omaha is separate from any other contract they offer. It's just for their prescription drug plan. And Clever RX is actually a discount plan, not a prescription drug plan sanctioned by the government. The Medicare supplement programs we offer, robust portfolio, and we have different marketing programs in play to help you be successful in that space. And though we speak to low income subsidy today, for those that are active in the Medicare supplement space, you might find that as a valuable component in selling Medicare supplement plans as well, because let's face it, most of the time you talk about a med sup, you're going to talk about drug coverage as well. When we look at the ancillary products in each of those categories, you have the national leaders for you there for your use. These not only create additional marketing opportunities in addition to satisfying the needs of our prospects and clients, but also create an additional revenue stream for ourselves and our agencies. When we look at the Medicare market overall, this is particularly pertinent to today's discussion in the fact that, well, hey, if we're looking at just aging into Medicare, near exponential growth, over 63 million people in Medicare now. And if we look at it just based on the age, we're looking at a little bit of well, not a true number, because we're seeing more people hit the age of 65 and not accessing all of their Medicare benefits when they're first eligible. Multitude of reasons. Well, pandemic's been tough on people, so they're working longer. For those of us at the tail end of the baby boomers, we're also finding that, hey, in order to get full Social Security benefits, we got to work till up to 67. For whatever reason it is, we see some people delaying accessing full Medicare benefits, but that market is more than compensated by the number of people that are under the age of 65 accessing Medicare benefits because of disability. We find that in this category, many of the folks are eligible for additional assistance on their medication costs. It's a question of locating them and helping them with understanding how these programs work for them. Because plain and simple, no matter what choice they make as they access Medicare benefits, well, they have choices, plain and simple. They can decline Part B should they choose to do so. Thankfully, most don't. Some will then self-insure for the shortfall of the full financial coverages within the Medicare program itself and pick up a standalone Part D program to help with the medication cost. Some will actually enroll into a standardized, modernized Medicare supplement, Medigap plan to cover that financial shortfall and pick up a Part D program additionally to cover that expense within covering their prescriptions. And then some will bundle into the Medicare Advantage programs, the Part C programs we hear so much about on television with commercials. In each of these categories, however, we find that the extra help programs, the low income subsidy programs can make a difference in how we market these options and how they can best suit the population we serve. And we find that, well, folks are making some pretty even splits as to their choices as to those base coverages. Are they going Med Sup? Are they going Medicare Advantage? Are they self-enrolling? Well, we saw in the past that it's been a pretty even split between Medicare Advantage and Med Sup programs, and you have a portion that still show as original Medicare only. Those can be dual beneficiaries. They can be folks that are accessing coverage through a retiree or union coverage. They may be self-insuring, plain and simple. Each of those areas offering information about assistance with medication costs can be very valuable, and particularly when we're seeing the trend coming more to the Medicare Advantage than Medicare supplements, slightly influenced by the pandemic and other factors moving into it, where many of the folks that are aging into Medicare are more comfortable with network-based programs than some of the older individuals. Well, for whatever reason, in each category, we have needs that we need to address. And one of those needs is translating the language that's put upon this population. Plain and simple, every portion of our life has, every subset of what we deal with has acronyms that we deal with. And the government is really fond of them. Medicare in particular can be. And no matter how long you've been in this business, you find that one pops up and you go, what do they really mean by that? Well, this is a guide, a link to the guide that CMS offers that gives definitions on acronyms. We see too that one of the key components that we do when we look to market year round is what does the government allow us to do? We see some of the standard enrollment periods that we have. We're past each and every one of these, but we have the special election periods, the SEPs, and one of the ones that they speak of quite frequently deals with today's topic, and that's special enrollment periods for dual eligible or LIS eligible individuals, where these folks then have the opportunity to examine their coverage, make a change one time per quarter through the first 9 months of the year. Fourth quarter, it's the open enrollment, the annual election period that comes into play. But that gives us the opportunity to examine coverages and make changes as necessary throughout the year. Because if we look at the overall SEP codes, well, gee, if you look at just the top 20 that are fairly standard, you see a large number of them that deal with drug coverage or they deal with financial circumstances. And this is actually added on to the extra special election periods that are brought about by special circumstances, whether other areas that prohibit people from exercising a choice at one particular point in time, and they have a way then of changing the coverage in the future if they qualify for one of the standard, if you want to put it that way, SEPs, or one of the special SEPs brought about by special circumstances. That's important for us because Kaiser Family Foundation tells us that the majority of people, and the vast majority of people that are on Medicare, don't compare their Medicare plans year over year, as they should, as we all should. And we see that that is a fairly standard percentage no matter what their choice is for their base coverages. And we see that the Medicare Advantage area, well, you got a little higher shop rate on it. Well, part of that might be because of all the bloody commercials or whatever. But we see then that this gives us the opportunity that as we visit with folks, we will run across people that, hey, they don't really know what their coverage has done this year versus last year because they didn't compare it. They don't know if there's a better buy out there. And a lot of times through the first quarter, the first half of the year, they are discovering some of the changes in their base coverages and particularly in their medication coverages, where the drugs may have changed as part of a formulary change from the company or because of a tier change or for whatever reason it is. But they then have that need to examine options. And that's particularly important in the more vulnerable groups. And that deals with our topic today, where we're looking at some of the lower income individuals that have challenges with their medication costs, and they don't necessarily realize that there are programs out there that can help them with those costs. And that's part of where we come into the picture, where we're able to deliver that information, do an analysis, look at the plans available for them in their market, and then suggest some possible changes. And that's important because even the people who are in a standalone program or an MA program, they don't compare that coverage, and that can really cost them literally hundreds and possibly thousands of dollars because they didn't take that extra step to compare programs. They're not even using the government sites. Part of it may be because some of the lower income people may not have as much access online or aren't responding to the plethora of television ads or whatever it happens to be. Well, it's just not getting done. They're not reading their handbook, perhaps. Well, let's be honest. How many of us all read through all of our benefit packages and know everything about them? You usually encounter that one, gee, I need to use it. And this is a population that, once again, may or may not have smartphones where they're looking for coverage ideas or information about the coverages that are available to them through Medicare, through the government itself. So no matter how we're looking to dispense the information, the difference in many times boils down to us as insurance agents, as qualified, licensed, certified agents that help them discover how they can make Medicare more affordable to them. And that's important because we're seeing an increase in not just the folks that are eligible for LIS, but those that are looking at the dual market as well. We're not going to spend a lot of time on that today. We're going to concentrate on LIS, but you're going to run across these individuals. And so having information from some of our other presentations can be very, very helpful for you. And we need to make certain that we're able to deliver that information in a manner in which the folks can receive it, understand it, and discuss it. And sometimes that means moving back and forth between an in-person or a virtual presentation and having the capability of doing so. When we go into some of the segments of the Medicare population that are a lower income, they may or may not have some of the virtual opportunities. So this might be a market that is more face-to-face or in a manner where we're looking at some of the old school ways of delivering information. But the population is increasingly digitally savvy, and we've trained the population. We as a society has. During the height of the pandemic, we saw a lot of doctors having their visits done all virtually, primary care physicians, specialists. We saw hospitals doing a lot of the prep work, some of the other things virtually. Same thing with dentists or anyone that's providing services to the Medicare population. They're delivering it in a fashion that way in order to get the information to the people in a timely manner. Hey, we're even seeing other portions of our day-to-day lives that are all online, faith-based celebrations, uh, all factor into the premise that the population is increasingly digitally savvy, as I mentioned before, are open to receiving information in this fashion. And so we're able then to make certain that we're delivering upon the information that's necessary to help people understand what their options are. This actually can be a very key point also if you've got other people involved in the decision. So if you have family members, normally younger family members, that are also examining the information, you can kind of get ahead of the curve and supply not only the beneficiary, but the others that are involved in that decision process, the information, and then truncate, in a manner of speaking, the decision making process and make it happen much more quickly. So when we look at using LIS and Medicare to create sales throughout the year, we're looking at a governmental program that enables the population, for those who qualify, to get help with their medication cost, and for us, an opportunity to speak to people year round and make changes year round as well. So the value that we bring with the Part D low income subsidy, the extra help programs, is important because anyone who qualifies for these plans, well, it can maximize their plan benefits and minimize choice and cost challenges that they may have otherwise. And what do I mean by that? Well, the parameters that are placed upon the cost of medication through these programs can layer on, or does layer on, to any type of program that they already have in play. It then also creates that special election period I alluded to a bit earlier, where they have the opportunity of once per quarter of changing their coverage. It does affect the costs of their plans, the applicable copays, the coinsurance, coverage gap, and possibly catastrophic coverage costs. And what I mean by that is it will subsidize up to a point the cost of the medication plan itself, be it a standalone program or embedded in certain types of MA programs as well. It does change the copays of the plans. If the plan copay is lower than what is the mandated amount through the extra help program, obviously the lower copay comes into play. But we see many folks then able to utilize this to drive down their out-of-pocket cost for those copays, any applicable coinsurance, narrow that gap, that coverage gap, the donut hole, and help make certain that we're able to contain cost as much as possible. It also helps for the folks that may have not made the decision to enroll in drug coverage when they were first eligible and are now suffering enrollment penalties. This then will help take care of that. It does not, however, affect the way their current plan is set up. So it doesn't add medications to the plan formulary. The list of drugs stays the same. Any step therapy or quantity limits that are put into play by the plan itself, well, they're still there. It then gives us then that opportunity then, because of these reasons, to make certain that we're able to compare programs. And remember, 7 of 10 thereabouts haven't done a year-to-year evaluation. We may very well see other programs available in their market that can be more favorable to them financially. And because of this portion of it, we have the opportunity to affect change. And by doing so in each of these areas, it's increasing our prospect pool. It gives us also an opportunity to go back to our current book of business and make certain that as a discussion point, we're able to then perhaps revisit this or visit it for the first time with people that we've talked to in the past about their choices to see if, boy, do they qualify for these programs? Is this a way that I can not only increase my prospect pool, but I can aid in the retention of my book of business? So when we look at and are familiar with the low income subsidy benefits, it's very important for us to realize that this is one of the ways that we're doing the best thing we can for our prospects and our clients. It's making it harder for anyone else to replace your product. And if you're not speaking of this, there may be other agents that are using this program with your finger quotes working, your book of business, and replacing your product. And if you already have a plan in place with these individuals, creating the opportunity to apply for this coverage should they choose to do so, well, it can enhance the program you already have them in. Remember, it's going to drive down those co-pays, the co-insurance, all those different pieces, cost of the program itself, if that is a parameter that you're dealing with. That SEP, well, that gives us then that way of growing our pool of folks that we can visit with. It also gives us an opportunity to manage our time. And what do I mean by that? Well, because this is a quarterly SEP, it enables us to work through our book of business, visit with everyone, using this as, hey, I'm not certain if you qualify for this. We want to make certain we're doing everything we can to help drive down expenses in your household. Let's examine this program. It's an opening of a conversation that then may well give you the opportunity to mine for other needs within that household and do so on your timetable. It also creates the reputation that we're all looking to create within our market, where we are a source of information that makes you much more referable. And that many times is a simple, do you know of other folks that these programs may be assistance or of assistance to? And in certain cases, well, gee, we tend to hang out with people that are kind of like us. So you hit one person that qualifies for this, you're going to find others. You might hit someone that doesn't qualify for this, but they know of others that can help, and that can make a big difference. It's also important to note that when we deal with this population, low income subsidy is available in one degree or another for folks up to 150% of federal poverty level. When we get into discussions about dealing with dual special needs plans or the full dual beneficiary, you're looking at people that generally are cut off at about 100% of federal poverty level. You got 50 points in between there, and it's a different mentality of the folks that you're visiting with as well. So you have an opportunity to help people when they may not be expecting that assistance, and give you the opportunity then to deal with people that may well have other opportunities to purchase additional products simply because, well, hey, they are the near poor. They can still afford some other type of coverages for needs that are pressing for them. What it can do, obviously, is it gives additional access to those prescription drug coverages. So if you run across someone who didn't pick up a drug program and they are first eligible, this is a way that you can use that SEP, and because of the low income subsidy, deal with what may otherwise have been an enrollment penalty. So you're granting greater access to prescription drug coverages through your good work. It also protects people from that infamous donut hole, the Part D coverage gap. We've heard a lot over the last couple of years how this is narrowed. However, there's still greater out-of-pocket exposure during that time period after the initial benefit period has expired. It gives us then that opportunity to help protect people as they enter into that higher out-of-pocket area. As I mentioned before, it does waive that late enrollment penalty for Part D. So as you run across people with that, if they qualify for this, well then, hey, you're going to help there. And once again, I'm going to harp on this. It allows for that special enrollment period, because when we looked at some of the demographics of this population, that income, median income, is right around $26,000, $27,000. You're going to find a lot of people that qualify for these programs that may well not have it in play. And through the course of this effort, you may also run across people that may qualify for even additional assistance through perhaps a Medicare savings program. We have other recordings that will help you in that regard and make certain that you have the information necessary to cover the gambit, the full range of the Medicare beneficiaries across the board. Give me half a second. We have a question that popped up. One of the questions that has come up here too, when it's, are we not restricted from contacting prospects until they reach out to us? And do we need a scope of appointment? Yes and yes. But one of the things that I'm visiting about here too is, as you run across people through legitimate compliant marketing activity, you're going to find these people because there's a lot of them. And that if they have responded to your outreach in that circumstance, that gives you the opportunity to discuss these programs. I'm not about to suggest that you cold call for this. That's a big no-no. That's not going to happen. There are a lot of direct mailers and other programs on the internet where people will use to reach out for people in this area. The other portion of it, of course, is another compliance piece. And yes, before any discussion about Medicare programs specifically, you need a scope of appointment. To discuss low income subsidy, technically you don't, but you know that's going to lead into discussions about drug programs. So it's to your best interest, to say the least, to make certain that you have that scope in hand before you go into a lot of detail, and that you store it properly for that 10-year period if you enroll them or not. So back on to what are the general eligibility rules for low income subsidy? Well, the person must have Medicare Part A and or Part B. They've got to live within the United States, the 50 states or the District of Columbia, and they must meet financial eligibility criteria, both an income and a resource test. We'll talk about those specifically in a little bit. There are folks that are deemed eligible that automatically get LIS because they have another needs-based benefit. So these are folks that are receiving Medicaid, be it community-based or within an institution, folks that have SSI, supplemental security income, or enrolled in a Medicare savings program. These folks don't need to apply for LIS. They get it automatically. And generally, when folks are found eligible, they receive these benefits for the remainder of the calendar year. You'll see the numbers change over year to year. And well, in the past, boy, it was almost into April before we found the next year's business numbers that we needed to apply for this. Now we're seeing them mid to late February already. Some of the things that come into play with the basics of Part D benefits. Now, keep in mind, a lot of this applies to the base prescription drug programs where the parameters set up for this give us an idea as to why this can be so very, very valuable. If you have a person who selected a standalone drug program based just on the monthly premium, and they're going for the cheapest animal in the cage, so to speak, well, they got some out-of-pocket exposure they may not have on a little more expensive program when it comes to premium that can save them dollars. What we saw 22 over 21 is an increase in the deductible, the base deductible from $445 to $480, and the initial coverage limit increase from $4130 to $4430. So they get an additional $300 worth of coverage on the initial portion of it. That out-of-pocket threshold goes up from $65.50 to $70.50. So they've got to come out of pocket a substantial amount of money to hit the catastrophic limit. And it's also important to note that the dollars that come into play, the income, has increased year over year as well, from about $9,300 to a little over 10 grand. And those folks also have to deal with some of the challenges that come into play for the coverage gap discount. which is the thing that I referenced a little bit earlier. While that donut hole has shrunk, you still see money coming out of the pocket. It's a little larger exposure in that area as well. Some of the things that really give us a hint as to whether or not someone has this benefit in play already may well be just what they're paying for their medications. So you see the standardized, in a manner of speaking, co-payments for these programs based on the type of medication and the copay that comes into play. So for generic medications for 2022, we're seeing a $3.95 out of pocket for those medications, $9.85 for other medications, which is up a little bit year over year, a quarter and 65 cents from what we saw in 2021. We also have seen, and this gives us an idea, I left this in here because this is the difference that we experienced from 2020 to 2021. So we see where these dollar costs keep going up year over year, but having low income subsidy can help then minimize the exposure regardless. However, a lot of the assistance on the cost of the medications themselves depend upon how the plan is priced, how that prescription drug program or the cost component in some MA plans come into play, and does that match or go below what is called a benchmark premium. And this is the maximum monthly Medicare Part D premium that will be paid by CMS for people that qualify for this benefit. So if someone selects, excuse me, if someone selects a standalone Part D program where the premium is higher than this amount, well, they only receive the subsidy up to that benchmark. The dollars above that are still their responsibility. So even though in those circumstances, the monthly premium might not be zero, the premium will be reduced. This then gives us obviously another talking point as to, well, gee, there may be programs out there that can cover you without an out-of-pocket exposure for the premium itself and may well do a better job for you in covering your medications as well. So we want to make certain that these folks realize that those partial premiums above a benchmark is their responsibility, but we have an opportunity to help them shop coverages. And remember, the majority of them hadn't done that year over year, and see if perhaps we look beyond just the premium of the plan itself and the full out-of-pocket exposure that if someone has in making a choice as to their drug coverage. This can be a big, big value to them, and is actually one of the reasons we go through this as much as possible. It's also important to note that these benchmarks do usually change each year, and we see increases or decreases in these, and a lot of that depends upon some of the competition for the plans that are out there, and we see how these benchmarks have fluctuated from one year to another. And we see also that in 2022, there's a substantial number of programs that, well, not as many are available that fit that benchmark. So we're going to run across people that may not have encountered that partial subsidy in the past that may be well subject to it now in 2022. So again, I'm going to check for a question here. One of the folks is asking about the Social Security, about the application for LIS. There are some things we're going to discuss as to how you can help them qualify, and we're going to talk about that in just a moment, Charles, so we can go through that and speak to making a determination. And do you have to be 65 in order to qualify? No, anybody who is on Medicare will qualify for this assistance should they meet the parameters set by the program itself. So we see that there's a lesser number of standalone drug plans that meet the benchmark. So we're going to run across more people that way as well. And we also see that beyond pricing of the programs themselves, we know that the plan prices change year over year. We know that formularies change year over year. We know that tier structure changes year over year. But this situation is also complicated by the fact that there are medications that are increasing in cost that have been on the market for years. And we see different plans that come in, or different pricing structures come into play because perhaps a medication is now being utilized for more than just the initial reason for that medication. So we're seeing shifts in tiers, we're seeing formulary placement, and in all honesty, these drugs can stay on the formulary itself, but switch from one tier to another, and that creates that additional out-of-pocket exposure. So all of these reasons give us a further kick in the tuchus as to we need to get out and help these people, simply because even if the plan that they selected may well be the least expensive in certain circumstances based on just medication placement, it may be influenced by different drugs being handled differently. And we're seeing a shrinkage, to quote Seinfeld, of drugs on formularies. Now, in order for a drug plan to remain compliant, in a manner of speaking, they've got to cover all drug types, but we're seeing fewer medications in many cases in a drug category be made available to individuals on the same drug plan. So you're seeing some medications go off formulary simply because, well, the plan sponsor may be looking at costs, or for whatever other reason they use to create their formularies. Once again, these can be of great help to people because they can lower the premiums for the drug costs themselves, or the drug plan itself. They can lower the deductibles and obviously create less exposure for a co-payment as well. This gives us the opportunity, once again, to go back and not only market, but help solidify our book of business so others can't use this same method to take our folks away from us. It does boil down to, in many circumstances, because we see so many people within the Medicare community challenged financially, that these quarterly enrollments can make a huge difference to them. We've all, in many cases, I shouldn't use such a sweeping generalization, but we've all had times in our lives where it seemed like we had more month than we had money. And utilizing some of these programs can really help address that need for folks and give us the opportunity, plain and simply, to do our job, to go out and help this population and benefit from it ourselves as well, because not only do we get the intrinsic value of doing good for our people, but that extrinsic reward of, hey, if we are able to help them find a plan that's of better value to them, plain and simple, we're going to be paid a commission on it. So let's make certain that we're able to do that. It's also important to note that even if a person did an evaluation of their coverages and they didn't look into whether or not they qualified for low income subsidy, well, they have an out-of-pocket exposure greater in 2022 than they did in 2021 in a large percentage of these folks. So if they stay in the same plan and they don't have another way to contain cost, they're going to come out of pocket more this year than they did last year. That, once again, gives us the opportunity to meet a population that is more willing to speak with us because, hey, the pocket's getting pinched here just a wee bit, and we want to make certain that we're able to help them contain that cost. It is important to note that low income subsidy has a couple of different levels of help. There are the folks that qualify for full help, and these are the people with lower incomes and fewer resources. But then there's also that portion of the population that qualify for a partial subsidy. And these are the folks that are slightly higher income and resources, referred to as the near poor by certain individuals. And both of these levels do eliminate that Part D coverage gap and deal with that late enrollment penalty if it applies to these individuals. So regardless of what level of assistance they qualify for, the program has true benefits for them. And as we're able to speak with the folks that are perhaps at between 135 and 150% of federal poverty level, these are people with a little bit more disposable income. But if we're able to help contain costs on their medications, that's going to free up dollars as well to help them cover other needs. Perhaps they need dental coverage, or they need a final expense program, or if they're looking at certain things to help with critical illness cancer plans or hospital indemnity programs. Whatever it happens to be, we're freeing up premium dollars in many circumstances, and taking care of that nagging need of how am I going to pay for my medications. For those folks who qualify for full help, however, there's no plan premium as long as they're in a plan beneath the benchmark amount. There's not a Part D deductible. It's going to limit their co-payments that they have, and depending upon where they fall in that income scale, can greatly reduce their co-payments for their medications. And it does away with co-payments after reaching the catastrophic limit, which we can see can be a percentage of the cost of the drugs. And even though that's catastrophic care, it can still be pretty expensive. For those that qualify for partial help, this does help with the premium of the medication coverage itself, the plan premium itself. You can eliminate it, or at least take and cover a portion of those costs. It will at least squeeze down that initial deductible that they come into play, and squeeze down the co-insurance that comes into play. And if the plan has co-payments, it narrows those as well. And we see that the scale on which they pay, well, if someone's between 135 and 140% of federal poverty level, they're only going to pay 25% of the premiums. And that goes up as people reach into the 150% federal poverty level. These are pieces of information that can be very, very helpful for you in discussions with your prospects and clients. They're supplied by the National Council on Aging, so a strong third-party reference. They are compliant to share with prospects and clients, and it gives them the detail in writing of everything that we're talking about. And nearly as importantly, it gives us the reference material we need to discuss the benefits that they have. And so we see that in the 48 continental United States and the District of Columbia, we have certain limits, different ones for Alaska and for Hawaii, but it gives us then that opportunity to discuss specifics and deliver upon information that can help with the folks that have a bit of healthy skepticism. Is this real? Or you'll see some of the advertisements for these programs, sponsored advertisements by the National Council on Aging on Facebook and some of those. If you ever read the comments, healthy skepticism may be an understatement. So this is information that you can supply in order to make certain that folks realize that, hey, I only speak the truth in this circumstance. How you can help folks with these. So this is a portion of what we go through, Charles, and one of your questions that you asked. One of the things that I would caution people about is making the determination for an individual based on our own circumstance. Let the authorities in charge, in a manner of speaking, make that decision for you. Because we see sometimes folks at a borderline level of income or assets sometimes get approved because they are able to, excuse me, find other means of helping an individual qualify. And you can do so fairly simply as an advocate for the individual online. Strongly recommend that over the paper form, because the paper form has all the challenges we see in other portions of what we do day to day with our handwriting and everything else. You can submit an incomplete form, whatever. You can go to ssa.gov. There's a portion on there where you can help people with applying compliantly through the website. You can do it with them face to face. You can collect the information and do it later for them, however you want it done, or is the trust within you and your prospecting client. And the Social Security Administration will expect or will accept an electronic signature to complete this application. It is important to note too that there are also other resources that can be helpful in this process. The Benefits Checkup Program can help submit these low income subsidies and look for other assistance programs as well. And with certain carriers, they actually help subsidize this. So you see Aetna, Anthem, a number of the large carriers that will subsidize this for folks to help as well. There's no cost generally to utilize this service. However, we want to make certain that we're utilizing all the resources and we're tying into the folks that we do business with as well. You can defer people to SHIP, the state health insurance assistance programs, to help people with these applications as well. I would generally not advise that personally, simply because you're ceding control in that circumstance to a governmental agency that may or may not have different opinions about coverages other than what you're offering. We're going to put it that way. Applying for this, once again, online's easier and faster. It doesn't require verifying documents. The Social Security Administration will use federal records to verify answers. If we're using paper, if it's incomplete, Social Security is going to follow up by phone with the applicant. We know how well that's going to go over. And gee, for those of you that cold call for programs that allow that, not always easy to get a hold of an individual on the phone. Not everyone answers their phone anymore. It's also important to note that if we're using an online application process, you can't submit it until it's complete. So it makes certain that we're able to deliver the information that's necessary on a timely basis and know that it's going to be processed. It is also very helpful that if we're working with different ethnic niche groups, all the instruction sheets for this program on Social Security website, it's available in 15 languages. So even though we may not speak a language, we may have an interpreter involved, a family member involved to help with this. Well, this is kind of a third party, once again, verification that what we're doing is correct and we're taking care of it. And once again, we have the portion of folks that are deemed into LIS because of other programs they may qualify for. These are how the applications look. You see an online app, you see a paper application. Back in the day, I always kept paper applications in my briefcase simply because some of the folks, as we hit an interview or a discussion or an appointment, we may have run out of time to complete an application on site, and collecting this information and submitting it later is permissible. Remember, once again, we can do that as an advocate on the Social Security website. So however we're garnering or gathering the information, we want to make certain that we do it properly, and they're going to receive a letter saying, well, hey, you're approved or you're denied, and they do so fairly quickly. You have different reference material that's available to you that help with this information. For some of the folks that have internet access, and well, gee, that NCOA, I saw stuff on them on Facebook. I don't know if I believe this. Well, you have other pieces of reference material that you can supply for them so they understand that this is a valid program and available to those who qualify. A great deal of information made available to you online through the government and other organizations. This is also a program that you can use as a presentation piece, either live or virtually. So if you're doing seminars in different locations, speaking to this is a piece that's given to us or supplied to us by the National Council on Aging. We make this available to you as well. Obviously, you'll want to put a better looking picture on there than the one that's there and your particular information, but it gives you then a way of walking through this process to a group, be it in person or if you are staging a webinar or a Zoom call or whatever it happens to be. There are also other pieces of information available to help explain these programs, going into further detail, including the Medicare savings programs, which may be a topic of interest for folks that say, hey, my income's way below that. So it gives you an opportunity to roll into some additional information as well. It's also important to note that even though we may have folks that are in an MA plan, an MAPD plan, a Medicare Advantage prescription drug program, I've harped about, don't use acronyms, you'll see that many people on these MA programs may qualify for this assistance as well. And this can make a big difference as to the cost of their MA program. Because remember, if they're in a plan we've enrolled them in or not, these limits of out-of-pocket exposure applies in that fashion as well, because those drug programs in many cases mirror some of the standalone programs, but the co-payments may be affected, the out-of-pocket exposure most certainly is, and so it gives us the opportunity to cement that business as well. And once again, we have the different tools that are out there to help us utilize not only information for low income subsidy, but for other ways that we can positively affect the lives of the folks that we deal with. Why do you want to deal with us when it comes to this? And excuse me, I'm checking a question here again before I go into that. Where do you get the presentations? Gail, we have these available, and we'll make certain that the marketers have that low income subsidy presentation for you. If you're working with a marketer now, they'll have that. If you're not dealing with us yet, you can call into our offices or respond to the email I send out, and we'll make certain that we take care of you in that fashion. Some of the things that you get by working with us here at Premier, well, because we're talking about not only marketing year-round, cementing our business, we're also looking to cross-sell. Sometimes that requires additional contracts with some of the ancillary carriers. Creating an agent profile within the SuranceBay program enables you to contract electronically, speeds up the process, all the other pieces that are there. Plus, it's a great place to store your information and make certain that you have all your duckies in a row in that fashion. We do offer discounted errors and admissions coverage for qualified agents. What's a qualified agent? You got a contract with us. This, however, is a program you own. So it's not like being added to a blanket E&O policy for just one carrier, and then you wonder how you can satisfy that requirement for everything else you do. This gives you the opportunity to satisfy this requirement that just about every insurance carrier and program requires now, regardless of whom you contract through. You get a discount if you're going through just our products, obviously because of the numbers that are put up there, but the premium difference isn't huge, and they'll take care of you regardless. Nobody offers every program in the world. I don't care who you're working with a marketing organization. This can take care of you in that area. We also help with discounted continuing education programs through our association with WebCE, where we bundle those programs and discount the cost of them. And you have a way also of protecting your own income. As an independent agent, you are responsible for your own benefit package. This gives you an opportunity to qualify for modified guarantee issue programs to protect your income, and you're paid a commission on it. Much as where today's presentation is being recorded, past presentations has been as well. And as I mentioned at the beginning of today's topic, well, They're available on our website and on our YouTube channel as well. So they're there for you that you can access 24/7. We do also offer a great tool that can be very valuable for you for contracted agents within the premier marketing arena and our integrity partners. You have complimentary access to Medicare Center. I'm an old MA agent, so I have a hard time with the word free, but it's free. It gives you access to systems through a universal login to 3 quoting engines and other tools. Gives you that opportunity to offer side-by-side plan comparisons compliantly, collect and store that scope of appointment you need to do with everybody that you talk to about these programs. It has a CRM within it that you can utilize and different learning center resources, including scripts, other hints and tips that can be helpful for you, all available to you without cost. It has a great tool within it as well that helps you cross-sell through the CSG component in it. So we talked about, okay, multiple quoting engines. Well, it's powered by CSG, but also Connecture and Sunfire. So you have the different pieces in there that can be very helpful for you. The CSG component has a great cross-selling tool for you to use. We also realize that in the Medicare Advantage or PDP world, the compensation that you are eligible for, the max is set by the government. So there aren't a lot of other incentives financially that come into play there. But if we're dealing with cross-selling, many of the ancillary programs or med subs as well have different incentives offered by the carriers that not only pay you dollars perhaps, but help you qualify for trips and qualify for premier incentive programs as well. So we have a page on our website that puts that all together so you have that information in a singular resource. We also help put you in front of folks with different marketing programs, call lists, community-based programs, dealing with carriers and some of the prospects that they can help generate, internet and direct mail programs, a T65 locator, and a really cool referral program that enables you to multiply a single lead into multiple leads just by asking questions at the most appropriate time. That direct mail program is based on production, but you can qualify for 2 different ones. You can qualify for health programs and final expense, and it gives you the opportunity then to basically have that cost and do so. By doing so, it enables you to be consistent in laying out that information. So it's not like exercising once a month and feeling the pain. You're doing it regularly, you're going to see the results. We do so through vetted lead vendors simply because we want to make certain they have the systems to support you, and we're able to vet the information that they're kicking out to help keep you in compliance. We do also have a program for folks that don't necessarily want to do a complete mail campaign, but wouldn't mind having a few responses come their way. So this organization gives us the opportunity to purchase leads in different areas. These costs will vary from area to area, time of year, supply and demand comes into play here, but these are fresh direct mail returns that haven't been touched and enable you to fill your calendar throughout the month. The internet leads are based through Facebook. There's a program for final expense and for Medicare as well. And that T65 locator is a program you download to your smartphone, and it enables you to geographically determine where folks are based on certain parameters. Once again, this is one free, available to you without cost, with a contract with our organization, and you just download it to your phone, you register, they're going to verify that you have a contract with us, and there you go. You got access to that program. That referral program I speak to during the sales process, it's also important to engage that with our current book of business as well, because that's a great source of leads for us throughout the year. We speak to these programs and we go through these details simply because we want your business as well. And we look forward to the opportunity of earning that and enriching the relationships that we may already have in place with many of you. So knowing specifics about low income subsidy is something that I strongly recommend that you put as part of your personal marketing program. It gives you that opportunity to market year round and enables you to do something very, very quickly. It doesn't require additional certifications. If you've got contracts in place with MA and PDP carriers and you're certified, well, this just expands the opportunities that you have, and you don't need to procrastinate. You can kick it in gear really quickly and make certain that it works for you. So all that said and done, I'm going to check really quickly to see if we have any other questions that popped up. I think we're pretty good there. Yeah, I think we've got everything covered. So what I ask of you now is a moment to absorb a word of thanks. I thank you for investing your time with us here today in reviewing this topic. I thank those of you that have done business with us in the past, and for those of you that are considering doing business with us in the future, I thank you for that. Sincerely do. You can reach us through our toll-free number at 1-800-365-8208. If you're working with an agent success manager, a marketer within our organization, they're going to help you, and they will have some of the detail here that we discussed today, including the presentation. I'll make certain that they have that. You can also reach us through our website, premiersmi.com, or respond to the email that will come to you as well. So all that said and done, since we're just past the top of the hour, once again, I thank you for your time. And until we're able to visit once again, I wish you good selling. Thanks so very much. We'll talk to you soon.